Welcome to another Explainer. This is where we take complex topics and break them down into clear, structured insights that you can actually use. Okay, let's dive into this. Today, we're unpacking a topic that's incredibly serious, often totally misunderstood, and absolutely crucial for anyone who has a loved one in a hospital or long-term care facility. We're looking at the anatomy of neglect, specifically focusing on understanding and preventing pressure sores.
Now, you might be wondering, are pressure sores just an unavoidable part of aging? It's a super common misconception, right? A lot of folks just assume that if an elderly person is bedridden, skin breakdown is, well, just a natural, unavoidable consequence of getting older. But based on the medical and legal source material we're looking at today, that is a dangerous myth. The reality? These injuries are actually highly preventable. They aren't just an aging problem. No, they're very often a care problem.
So here's our roadmap for today's Explainer. 1. The hidden danger. 2. The 4 stages. 3. Beyond the 4 stages. 4. Prevention is possible. And 5. Taking action against neglect.
Section 1. The hidden danger. What is a pressure sore?
So, what exactly are we talking about here? Pressure sores, which by the way you'll also hear called pressure ulcers or bedsores, are serious injuries that develop when sustained pressure restricts blood flow to the skin and the underlying tissues. I mean, think about the mechanics of that for a second. When blood flow is completely cut off, the tissues literally begin to starve. And this most commonly affects folks with limited mobility, like elderly nursing home residents, hospitalized patients, or those with paralysis. If left untreated, well, it doesn't just mean a painful wound. It can lead to massive infections, actual tissue death, and even life-threatening conditions like sepsis.
Okay, so what actually causes this skin breakdown? Well, it's a combination of physical forces. We're talking prolonged pressure, friction, like from being dragged across rough sheets, shear forces, and excessive moisture. But here's the really alarming part. The biggest cause is often institutional neglect. In settings like nursing homes, these physical causes point directly to a massive failure in the standard of care. Because when a patient develops a sore due to inadequate repositioning or failure to use pressure-relieving devices, poor hygiene, or malnutrition, that represents a fundamental breakdown in their protection.
Section 2. The 4 stages, an escalation of tissue damage. Now, what's really interesting about this next part is how perfectly it maps out the chronological progression of these injuries. According to the National Pressure Injury Advisory Panel, the whole journey begins at stage 1, which is non-blanchable redness. At this point, the skin is still completely intact, but it appears red or discolored. And the key diagnostic sign here is that it's non-blanchable. What that means is if you press your finger right on the red area, it doesn't turn white. It just stays red. It might feel warmer or firmer than the surrounding skin, and the patient may tell you they feel pain or itching. But here's the good news. This is your surface-level warning sign. With early intervention and just some simple repositioning, stage 1 is highly treatable. But what happens if that warning is ignored? Well, then we move to stage 2, partial thickness skin loss. This is where things escalate. The skin actually breaks open, forming a shallow wound or fluid-filled blister. You're now looking at an exposed dermis, which is the second layer of skin, and it typically looks pink or red. Now, you can't see deeper tissues like fat or muscle just yet, but the danger has significantly escalated. The patient's pain increases, making movement even harder for them. And because that protective skin barrier is literally broken, the risk of infection begins to really spike.
If the neglect continues, the injury degrades into stage 3, full-thickness skin loss. And the imagery here is pretty sobering. The ulcer now extends entirely through the skin layers, straight down into the underlying fat tissue. It takes on a deep crater-like appearance. You might also start to see dead tissue, which clinics call slough or eschar, accumulating right there in the wound. The infection risk is incredibly high at this stage. And to fix it, it often requires surgical debridement, where doctors literally have to cut away the dead tissue just to give the body a fighting chance to heal. Finally, we reach the absolute most severe physical consequence. Stage 4, deep tissue loss with exposure. At this point, the sore has eaten away the fat and reached the muscle, the tendons, or even the bone. It's devastating. The wound is often covered with necrotic, dead tissue, and at this stage, the patient is at a critical risk for severe, completely life-threatening infections. We're talking sepsis or a severe bone infection called osteomyelitis. Recovery from a stage 4 ulcer is exceptionally difficult. It almost always requires major surgical intervention and a massive amount of long-term medical care.
Section 3. Beyond the 4 stages. Hidden complexities.
Clinical realities don't always fit neatly into boxes numbered 1 through 4. And this brilliantly illustrates that gray area. You've got unstageable ulcers on one hand and deep tissue injuries on the other. So an unstageable ulcer is exactly what it sounds like. It's a wound so completely covered in thick, dead tissue, that slough or eschar we talked about, that doctors literally can't see the bottom to stage it. It has to be surgically cleaned out before they even know how bad the damage is. Conversely, deep tissue injuries are incredibly insidious. The skin on top might actually look fully intact, but it'll look like a dark purple or maroon bruise. But don't let that intact skin fool you. That coloring indicates massive damage happening to the deeper tissue layers underneath, and it can break open and degrade incredibly fast if it's not managed. Both of these conditions completely conceal the true depth of the danger.
Section 4. Prevention is possible. Daily interventions.
So how do we stop this? Building a safety net for patients requires a really holistic daily routine. First, it starts with frequent repositioning. We're talking shifting their weight at least every 2 hours to relieve that physical pressure. Second, caregivers must perform daily skin inspections, checking those at-risk areas like the heels and tailbone. Third, nutrition and hydration. Giving the patient the protein, vitamins, and fluids they need provides the skin with the building blocks to stay resilient. Fourth, specialized equipment. Think pressure relief mattresses and cushions. And finally, strict hygiene control to keep the skin clean and dry. Now listen, this isn't some kind of experimental treatment. This is the absolute basic standard of care that every single facility should be providing every single day.
Section 5. Taking action against neglect, protecting your loved ones. So the crucial point is really what to do when that standard of care completely fails. If you have a vulnerable loved one and you suspect their pressure sores are actually a result of neglect, you must act quickly. First things first, document everything. Take clear, well-lit photographs of the injuries. Next, officially request the patient's full medical records. And hey, don't be afraid to ask the facility direct, pointed questions about the care they're providing, specifically regarding their repositioning schedule and their hygiene routines. Make sure to seek independent medical advice immediately so those wounds can be properly treated by someone outside the facility. And finally, consult a nursing home abuse attorney. Legal professionals can investigate the facility, hold the responsible parties accountable, and really help seek compensation for the medical treatments and all that unnecessary pain the patient has endured.
I want to anchor today's explainer on this simple yet incredibly powerful statement from our source material. Pressure sores are preventable with proper care and attention. These injuries should never, ever be viewed as an inevitable part of getting older or being immobile. When they escalate into stage 3 or stage 4, it is almost always a profound, unacceptable failure of care. Armed with this knowledge, you are now in a prime position to be a really powerful advocate. You know exactly what causes these sores. You understand the 4 stages of escalation, and you know what standards of care absolutely must be in place. So, I'm going to leave you with this final thought to consider for the vulnerable people in your life. Will you recognize the warning signs before it's too late? Stay vigilant, ask the hard questions, and demand the care your loved ones deserve. Thank you so much for joining me for this explainer, and keep learning.